Dr. Morris is a graduate of the Cleveland Chiropractic College, class of 1977. He became nationally known treating back and extremity injuries and was put on the U.S. Olympic medical team. He also worked as a team doctor for many leading sports teams, including UCLA, the LA Track Club, Cal State University at Northridge, and the LA Clippers. His expertise in the spine led to national lecturing in the field of joint disorders and publication in peer-reviewed journals. But what is your discovery?
Well, what happened? It was really simple. It really wasn't as difficult as you would think it would be. I'd say it was not rocket science.
Yeah.
These patients knew it themselves. They would come in and they would say, I'm fine when I'm sitting, and I can lie down, I can bring my knees to my chest, and I can stand up and I could bend over and relieve the pain. But it started out where it was difficult to walk, and then it became impossible to walk. And they had to eventually use walkers and canes and become completely disabled. But if they'd lie down and they'd bring their knees up to their chest, they'd relieve the pain. So what we did is we took these spines that narrowed, and we realized the reason it felt better is because as they were sitting, it stretched the spine. And as they bent forward, it stretched the spine, or brought their knees to their chest, it stretched the spine. And you can see why it opens up the canal. So that's what we did. We went in there and we spent 3 to 5 months on a regular basis, a very long treatment, and we loosened up the muscles in your back, which started tightening up, which happens with age. We then put them on a spinal decompression, so non-surgical decompression unit, that we'd gradually start stretching their spine apart for the first 10 minutes and then 15 minutes with very low weights, eventually go to higher weights, and we would do that repetitively. And then we gave them stretches and exercises and rehab that kept pulling them apart. And what happened, we just did a study, a 2-year study, that showed we took the average person who had a pain level of an 8 out of 10, and then within 3 to 5 months, the average pain was 2.3.
Do you give them pain relief medicine as well with this, or relaxant?
Most of the patients who come in here are on medication, all of them. They're usually taking Vicodin, sometimes Norco, some strong things, OxyContin. They sometimes take lighter things like Tylenol and codeine, but they're on heavy medication. Most of our patients in our study have already had epidurals. They've had physical therapy, they've had chiropractic, and it gets worse and worse because what's happening as they're getting older, it's compressing. And now it's right against the spinal cord and nerves. So when they leave here, actually, we're able to get rid of their medication. Most of the patients at the time of the relief were not taking medication. We're taking very little.
What is your center's approach?
The center's approach is they start off, and we have to accept them for treatment. The reason we have an 84% success rate, and we do, is because we're very selective of who we set into it. They have to meet certain qualifications for it.
Which are?
Some of the qualifications are, one, they cannot have a spinal fusion. If they've already had surgery that puts metal or fuses their spine together, we can't help them because it's already locked, and we can't say it's too late. We have to make sure the bones are dense enough that we can do the process. And I have to believe that the patient will be willing to spend 20 minutes to 25 minutes of exercise 5 days a week for the rest of their life. And we'll show them how to do it. If they don't do it, they will leave and do well, but it'll start coming back. Because gravity will keep squeezing you together, and it's our job to not only pull it apart, but we have to make sure they maintain it. So before I'd accept somebody, they have to meet those qualifications.
Tell me about the studies that have measured the Morris technique and the people who have been in your studies.
Okay. We started the study about 2 years ago with the patients that we accepted for treatment. We have right now about 70 to 80 people with severe spinal stenosis that have been followed. We've been following them for a year now to about 2 years to see what happens after they've left here. The inclusion into the study meant that they had to have pain level that was at least for 6 months. Usually they've had it for many years. They have to have been limited. The average person couldn't walk more than a quarter of a mile. They usually walk less than that. They can stand less than 10 minutes. That was the average inclusion for our study. And then following the treatment, they were, again, their pain level at about a 2. Our study at the end of 1 year, we want to follow people up and say what happened after they left here. And we found that after the first year, they did better than when they started. At the end of the second year, they're staying about the same.
How many people were in this study?
Right now it's about 70. Right now it's about 70 people with it.
So in other words, when they leave, you say, look, you brush your teeth every day.
That's right.
Yeah, this is,
There isn't a cure for this.
yeah.
Matter of fact, if you don't do this, what happens is a steady, progressive, degenerative disease, and it is crippling. So what this does, and the only difference is, you'll find it interesting, is that we only have about 11 millimeters of space in here normally. 12. Some people have 10. What happens is slowly starts happening as you get past 50 or 55 or 60, just because it just narrows a millimeter or two in this space. And all we do through 3 to 5 months is we increase it by 2 to 3 millimeters. That's it. So what happens with gravity and standing, it gets a little bit more narrow. So all we had to do is develop an approach that increased it by a few millimeters and have them make sure they keep it there on a regular basis. And at 2 years, they're still doing very well.
Do you do X-rays on them at the end to see how it's standing up?
No, well, sometimes. As a rule, we don't. We have MRIs before we accept them for treatment because I have to see what the spine looks like. I take some X-rays standing to see if there's a mechanical fault that I have to deal with, because if they're twisted a little bit, and that's where the chiropractic part comes in hand. If you're the least bit twisted or turned, it makes the canal smaller. So we have to make sure we do everything we can to get that strong. There is a study showing that people who had, people who had what we call HIZs, that means tears in their disc, that were showing up on MRI, when they were finished with just the decompression program themselves, this wasn't my study, it was somebody else's study at the Journal of Neuroimaging, 90% of them had healing take place of their disc tears. So what it's doing, it's pulling the disc apart, forcing blood back into it so it can start healing again.
Who are some of the people who come to you and their age?
The average, actually we're putting that together right now. I can't tell you the names of these people, but some people you would know. As a rule, what they are, the average person in our study, I would believe, would be probably between 65 and 85.
Oh.
They're not young.
Uh-huh.
Some people develop spinal stenosis when they're younger, but they're usually born with it or they've had a major injury that led to a fracture that displaced the canals.
During the 12 years that you were suffering, what did you do? I mean, and here
Everything.
you were trained at Chiropractic Institute. You were the, salutatorian, a prize student. How did it happen, and what did you do?
Well, it was, my son calls it the Greek tragedy. It was strange. I couldn't treat myself. I mean, you literally can't go back there and feel and examine yourself. You get an idea. So I had to depend on everybody else. So I went to chiropractors. I went to physical therapists. I went to medical doctors. I went to a neurosurgeon. I had surgery. I've had injections. I've had everything. Most of it made me worse or didn't help. Yeah. Eventually, I had to figure out what to do with it. And I'll tell you, one of the people who helped me a lot wasn't a doctor at all. He was somebody who had really good hands, who was a friend of mine. And he would give me a lot of feedback of what he felt and what he saw, and we worked it out together. And it made me much better doing this, the physical medicine. And eventually I started using spinal decompression on myself. And at first I could do it only for about 5 minutes at 35 pounds, and it was really painful. The other day I did it at 80 pounds for about half an hour, and I just felt good. So my spine's so resilient now I can get away with a lot.
And working with these various sports people at UCLA or the LA Athletic Club, what does this happen at a young age?
They don't get this at a young age.
Okay.
It'd be very rarely.
Yeah.
I spent forever doing sports medicine. That's what my love was. I was an athlete. I did the Ironman. I wanted to do the Olympics myself. I was not good enough for it, but I wanted it, and I trained hard. But when I really injured my back, it changed my whole focus, and I really don't care that much about sports injuries now. I'd rather help somebody whose life is being ruined by being disabled. It's so much more important. It changed the focus of my life.
Are you planning to go to the Olympics in China?
Well, not really. Not unless they take a trip and sit in the bleachers this time.
Yeah. What's the latest sports that you do now?
Well, now I'm much better. I went through about 12 years where I had a hard enough time standing. Now I run. I run about once or twice a week, just up to about 4 miles. I don't go any beyond that. I lift weights regularly. I swim all the time. Not competitively, but I'm so glad to be doing it. It's just so nice. And I know most of my patients with spinal stenosis, if they're listening, they're fighting depression. When you look at your life and you're in pain every day, and you see yourself getting less and less regularly, it causes depression. And so the patients I accept also usually have depression, and it changes as they start getting their life back again. It changes that too.